Good afternoon, and welcome to the AGC Virginia OSHA and VOSH Compliance Best Practices and Enforcement in the COVID-19 Era. I'm Gordon Dixon, the CEO for the Associated General Contractors of Virginia, and today I am pleased to be joined by Courtney Malveaux, who's an attorney with Jackson Lewis. In a previous life, prior to being attorney at Jackson Lewis here in the greater Richmond area, he was the commissioner at the Department of Labor and Industry, where he oversaw all Department of Labor Industry enforcement and compliance issues. Prior to that, he was an attorney, served in the Attorney General's office under Attorney General Bill Mims. So without further ado, I'm going to welcome Courtney Malveaux. Welcome, Courtney.
Thanks, Gordon. I appreciate it, and I appreciate the opportunity to share this messaging with the organization. I will tell you that just in reading what's been happening in industry around the country in Virginia, everyone's really dealing with some tough times, some unique challenges and safety concerns. And so while we're trying to keep our economy going, while we're trying to keep our businesses going, while we're trying to keep our workers safe, it's all under assault, and I thought that this would be a great way to make my contribution to you all in sharing some best practices and dealing with some difficult situations surrounding COVID-19. So I appreciate that, and things are moving really fast. The guidance coming from OSHA is moving really fast. The way enforcement is changing really fast, and so this is as up to date as through today, but by Monday or even tomorrow, things could be very different depending on what comes out from the agencies. So I will give you the best advice that I can give in with compliance issues, some best practices and enforcement, how that's being done in the COVID-19 era through up to this minute. So if you could advance for me, please. So the things I'd like to address for you. Oh, back up. Yeah, thank you. So first is changes in recording and reporting requirements. Secondly, I'd like to talk about best practices to prevent the spread of COVID-19. A third thing I'd like to address is some changes that are happening at OSHA and at Virginia Occupational Safety and Health, or VOSH, and also the guidance that's coming out of OSHA that VOSH is following with respect to the use of respirators and personal protective equipment. So let's go ahead and start with the first subject, and that's the record keeping and reporting requirements. So go ahead and advance, please. So there's record keeping and then there's reporting. And so most of you are familiar with this, but in case you're not, you have to keep in a record of illnesses and injuries. It's called the OSHA 300 log, and you keep that at your facility, and that lists the times when someone has days away or restricted work or transferred to somewhere else for perhaps lighter duty or different duties as a result of someone getting a work-related illness or injury. And so those are records that you keep on hand. And then if, God forbid, the day comes that you have an OSHA inspection, that's one of the first things that the compliance, safety, and health officers request. And that's also information that many of you, or all of you, should be, pretty much all of you should be recording electronically on an annual basis. So then that's recording, and then the reporting is when you have someone, something more catastrophic, say someone's admitted into the hospital, or there's a fatality or an amputation or loss of an eye, those types of things. Then those are reported within a short time frame where you contact OSHA or VOSH and you inform them of that occurrence. So that's the difference between record keeping and reporting. And so let's talk a little bit about record keeping. So the question that has come up is a case of an employee confirmed positive for COVID-19 recordable? That's an issue. I was at the Safety and Health Codes Board. I happen to sit on that board. We passed OSHA regulations in Virginia, and a colleague next to me showed me his cell phone with that question coming up. And I thought, oh, wow, is that, we didn't really have a quick answer for that, but ultimately decided that it really had to be a work-related illness for it to be recorded. So maybe that was the reason why COVID-19 cases would not be recorded. Since then, OSHA has come out with some more guidance on that. So under the rule that existed before the guidance came out, illnesses, of course, were recordable. If they were work-related, there are still exemptions to that rule. Two of them are the common cold and flu. And so the novel coronavirus is among a family of coronaviruses that includes the common cold. But OSHA has come out with guidance saying this is not the common cold, even if it is within that family of diseases. And even though it does have some similarities, if it is perhaps more severe and more widespread than the flu, OSHA has gone and said, no, this is a whole different animal. This doesn't fit under those exemptions. So OSHA, the initial guidance that came out several weeks ago, basically clarified that OSHA could be a recordable illness if a worker is infected as a result of performing work-related duties. But they're only responsible for recording if the following criteria are met. First, it has to be a confirmed case of COVID-19. It can't just be that someone is suspected of it, presumed to have it. It has to be an actual test, and that the test came out positive, at least one positive test. Secondly, that it would have to be work-related, and that's a big debate because when this was really starting to manifest in the workplace, well, you have no idea if someone caught it at the grocery store or from taking care of a family member at home, or if it's from being at work. You had no idea. And to this day, in most cases, I dare say, it's almost impossible to track. So that was a really big fulcrum on which this debate raged at first, and so, to some extent still does. And then also there are the normal criteria for recordability. And so illnesses and injuries are recordable only if you have medical treatment beyond first aid, or there are days away from work, or they're restricted duty, things like that. Now, I will say, you could actually have COVID-19. And if you're like me, you can work from home, and I do at this time. And in many COVID-19 cases, there may not be any medical treatment beyond first aid. If you're just taking over-the-counter meds for, and you're not being prescribed anything, and you're not necessarily treated, and if you're simply examined or is just turned around and sent home without treatment, then it's possible it may not be recorded even if you do have a positive COVID-19 test, but only if you meet these criteria. Gordon, would you mind advancing for me? So now, as of last Friday, OSHA came out with guidance really addressing what I thought was the crux, which is, you know, the focus doesn't need to be on these debates as to where someone might have got and when, frankly, we may never find out, but rather let's put our focus on good hygiene practices, best practices to prevent the spread. And so OSHA then, in response to those concerns, very correctly decided these work-related determinations are unnecessary for the most part, for most workplaces. And that is probably almost everybody who's watching this video. The only exceptions, the only workplaces now that OSHA is requiring these work-relatedness determinations are those who are in the correctional facilities, those who are working for emergency response. So, for example, EMTs, ambulance personnel, fire, police, and also, and of course, law enforcement personnel. So those industries, just because of their close contact with people who have exposures on a frequent basis, they do actually have to have some kind of work-relatedness determination. So, but most manufacturers, most of folks in our group, we don't have personnel in those spheres. Maybe occasionally you'll have one that does have, say, an EMT personnel on a large facility, but generally no. So if you don't have employees in those areas, then you really don't have to do work-related determinations anymore under OSHA. And then when I say OSHA, generally I incorporate VOSH because VOSH is taking its cues from federal OSHA. So there is no VOSH guidance on these matters. I anticipate none coming forward. So really just looking at OSHA's guidance is really where the action is. So there is, of course, an exception to every rule. The exception to this, you do not need to make a work-related determination rule, has exceptions. So if you do have, if there's objective evidence that a COVID-19 case is work-related, and if it was reasonably available to you, then you do have to make that determination. So I would say, hypothetically, if you have someone, I just had a client today tell me they have an employee who is COVID-19 positive. They know this for a fact. And if, let's say, this employee was not, didn't have COVID-19 infected individuals back at home, but did have several working in close proximity to them at work, you might reasonably make a determination that it probably was work-related. Then again, if there's no reason to believe that in this workplace, we're using best practices, we're using social distancing, nobody's coughing, nobody seems to have a high temperature, then someone has a positive test, then maybe you do decide that it was not evidence that it could be work-related. So, but unless you have those two factors in as an exception, you probably don't need to go down every single case and identify whether it's work-related. Gordon, would you mind advancing for me? So, there's a question, is an individual's COVID-19 test, their case, is it a privacy case on the OSHA 300 logs? And the answer is no. I think it should be. And I think if OSHA had a chance to revisit those rules on a fairly quick basis, it might do so. But so far, it has looked at the issue and has not touched it. And so on the log, you list the name of the individual along with what happened to this individual and whether they have days away or et cetera. And so so far, it is still a requirement that you include their name unless they ask to have their name removed. If they do it voluntarily, you're not twisting arms. But I do think it's a best practice because I think that most employers don't have an interest. You have an interest in identifying a COVID-19 case and trying to take preventive measures around that individual. And you can do that without releasing the name of the person. You can identify people who work close to that individual and try to take remedial steps without releasing their name. And so trying to protect the privacy, and certainly a lot of people who may have a positive test certainly have a strong interest in privacy, I would think. And so I think if you ask employees who have that positive test, do you wish voluntarily to have your name not included on the OSHA 300 log, I dare say most would probably say yes. And so you can do that under that circumstance. So the name of the identity of the employee, of course, I mentioned is confidential information. And so you're not disclosing it to others in the workplace. But that doesn't mean you can't disclose it to OSHA, to any other, be it any other state or federal agencies. One thing you cannot do is you cannot go back to employees and ask them about underlying medical conditions that they may have that might make them more susceptible if they caught coronavirus. So because that asking about people's medical conditions, if they have asthma or diabetes, really that is, you could run afoul of the Americans with Disabilities Act if you do that. So that's something you want to stay away from. So there are some privacy considerations and some steps you can take to protect privacy as much as possible. Gordon, would you please advance for me? All right, so let's do a few hypotheticals here. And the first is, must an employer record if the employee shows symptoms of COVID-19? The answer, no. The symptoms are not enough. Even if everyone is virtually sure of it, that they have COVID-19, it has to be a positive test. Number two, must an employer record if an employee with a confirmed case works at home? It depends. If that employee can continue to work, and much like many of us are doing today, if that employee did not receive medical treatment beyond first aid, then no, that would not be a case in which you necessarily have to record. Must an employer record if an employee with a confirmed case of COVID-19 is examined by a physician, then sent home and takes over-the-counter medication? No. Examination is not treatment, and over-the-counter medication is not treatment beyond first aid. So it really does have to be some sort of treatment, medical treatment. And so it's very common for people, as I understand it, that if they have COVID-19, that there's not really a cure, as far as most experts know. So it could very well be that there really is no actual medical treatment. Must an employer record if it does not know how the employee contracted COVID-19? Generally, no. So, in fact, the answer really is no. Most employers don't have to make that work-related determination. And so now if you happen to know and you have evidence of, you reasonably can obtain evidence that someone's COVID-19 case is due to a work-related occurrence, then that is something where you would record. But other than that, no, you really don't. So Gordon, would you please advance? Okay, let's talk about reporting. This is different, of course, again, from recording. This is when you contact the agency. So if, God forbid, you're in a situation where there's a fatality, then you have to contact OSHA, either online, by phone, and inform OSHA that this fatality has occurred within 8 hours of the incident. If you have hospitalization, inpatient hospitalization for treatment or for care, then you have to report it to OSHA within 24 hours. Gordon, would you please go in advance? Also, I'll point out that, and this may come up sometimes in the COVID-19 context, that while you do have to report a fatality within 8 hours, it gets a little tricky, because then if someone catches an illness and then passes away 30 days later, then after that 30-day period, then it's no longer reportable. The tricky part, though, is identifying when a person contracted COVID-19. And so, but if you have any questions about that, you're working through some of these situations, many of them are very fact-specific, then I'm here to help, and we'll work through it and do our diligence to make sure we make the right call. All right, let's do some reporting hypotheticals. First, must an employer report that an inpatient hospitalization of someone who has COVID-19 symptoms but does not take a test? There are two ways to look at this question, and I think there are two really good arguments that can be made. One really good argument is that, let's go back and look at the recording requirements. OSHA, when it came out with the rule that most employers do not need to make these work-related determinations, it did so for recording situations. It did not address reporting. I would say it is quite reasonable to apply the same analysis in a reporting context, just because those two functions, the recording and reporting, are accomplish some of the similar objectives, or in the same part of the regulatory structure, and of course they use some of the same terminology in terms of, say, work relatedness. So if it is so employer reporting an inpatient hospitalization of someone who has the symptoms but doesn't take a test. under a recording scenario, the answer is no. But then again, in light of the recent guidance, but if you look at the language of the regulations that precede all of this, really reporting happens when someone gets inpatient hospitalization as a result of a workplace illness. It doesn't specify the illness. So therefore, if you don't know the illness, having the symptoms of hacking, higher temperature, coughing, etc., can be the result of a lot of different things. So an argument I think also could be made that, well, if they get inpatient hospitalization for an illness, regardless of what it is, that it's still reportable. So many think the better view probably is the first one, but in either scenario, sometimes erring on the side of caution is the better part of wisdom. And so we can take a look at the situation, look at the facts, and make a decision that complies with our best interpretation of the regs and the guidance, and go from there. I wish I could make it clearer, but things are moving very fast. The agency is trying its best, and sometimes the guidance, surprise, surprise, is not 100% clear, and that's just what it is right now. Hypo number 2. Must an employer report a case of COVID-19 if the employee is examined in the ER, but then sent home? No. Getting examined in an ER is not inpatient hospitalization. You have to be admitted into the hospital, and that's beyond the ER. So no, just an ER, and that happens very frequently with COVID-19. I understand that they're looked at and they're sent home. There may not be additional treatment measures that are available. Must an employer report if it does not know how the employee contracted COVID-19? So no, it has to be work-related under even the old reporting rules. And the guidance that has come out since, if you apply the guidance of recording, now is basically saying that these work-related determinations aren't even necessary. So I think under either scenario, the answer would be no. Would you please advance? So you've reported. What do you do now? You've done the right thing. You're trying to do the right thing going forward. OSHA will initiate what's called a rapid response investigation. It sends you a letter, and you can reply one of two ways. You can reply on the non-mandatory appendix, which is a form that OSHA provides to you. I suggest actually sending back a letter that provides that information, but also provides context. And certainly it is advised in the agency that you're doing things. These are the steps that you're taking to remediate the issue. These are the steps you've taken to try to investigate what happened. I think anytime you have an opportunity to share with the agency what you're doing right and the best efforts you're making, I think it's always a good move. So reasonable minds might disagree, and maybe someone in the agency will say, okay, well, I see what you're trying to do. And may I suggest maybe see some other best practices I've seen elsewhere. And they're glad to do that. And so I think the letter is a great opportunity to just let the agency know what you're doing, and give the agency an opportunity perhaps to share any additional best practices. So, and then you're providing the steps that you're taking to address COVID-19 and to reduce any potential exposures in that letter. So it's right now, OSHA is overwhelmed. OSHA does not have the resources to send people to work sites. VOSH does not either. VOSH has gotten, as of Monday, 216 COVID-19 related complaints. They have 55, 60 compliance, safety, and health officers generally, give or take. And they can't go to all the work sites in addition to their ordinary day jobs. So they're not going to follow up. The only way they'll follow up is if you fail to reply or if you're doing nothing. If you're not making the right moves, then they said they're going to show up. So, so yeah, just, common sense governs at some point, even with our favorite agency. Gordon, would you please advance? So let's talk a little bit about best practices in preventing spread. Please advance. Thank you. So the OSHA recommendations, I mentioned that VOSH does not have its own guidance. OSHA has its recommendations. Unfortunately, they're coming out slower than the facts. Things are developing way faster than the guidance can come out. Some of the guidance has come out, more is forthcoming. I don't know exactly, we can kind of guess what else is coming out. This guidance is based on what OSHA initially put out when it was trying to get its hands around COVID-19. And OSHA is taking its cues from the CDC. And so if you want to try to predict where OSHA is going, keep an eye on CDC, and chances are OSHA will follow. So some of the recommendations include developing and implementing an infectious disease and preparedness response plan. And and you have to incorporate recommendations that come from local governments, state, federal, tribal entities, territorial health agencies. So you really do have to kind of keep tabs as an employer on what guidance is coming out from these various sources, localities. I know New York City and LA, some of the larger ones really do tend to have some additional guidance. So it's good to do that, check on that, and implement good hygiene and infection control practices in your plan. And you know what it is, it's the hand washing, and make sure you have the running water and soap. If you can't have that, at least some hand sanitizer, plenty of it for everybody. I know it's in short supply. Coughing into your sleeve, disinfecting. Disinfecting and cleaning is very important, especially in manufacturing plants, because if you have a lot of people who are sharing equipment, sharing workstations, then that regular sanitation in between employees is extremely important. And also developing and implementing procedures for identifying and isolating potentially infectious individuals. And that is not just your employees. Those are the people who come onto your work site from out somewhere else. That could be state or municipal inspectors. It could be customers. If you have, I don't think you usually have the general public flowing through, but visitors, vendors. So you really do have to encompass the hazards of having these additional individuals coming in who aren't necessarily aware of or following your procedures. And a lot of really good manufacturers are making sure that visitors are undergoing a certain training before they enter onto the floor, and revising that training before they come on and sign on and come onto your floor or into your facility is a great move. Would you please advance, Gordon? So a couple more recommendations to add to the plan is, well, make sure you're communicating with your employees what the plan is. Sometimes they think, well, gee whiz, where's my N95 mask? Why don't I have one? This isn't safe. You may be employing administrative controls that are sufficiently protective for your workplace. Just communicating with your employees goes a long way. It reduces complaints, and it also gives a great opportunity for employee engagement. And so getting feedback from folks who know what the hazards are at the ground level, or where they are, can be extremely valuable information for you to build into your plan. So that really should get wrapped into your plan, that communication. And also the implementing the hierarchy of controls that are applicable to your worksite. And I'll explain in the next slide. So OSHA has a hierarchy of controls. And so from your lower hazard employers, administrative controls generally are sufficient. And so your administrative controls are those that you can implement without any equipment. It's just trying to shift schedules, maybe flexibility in terms of when people can work, or different shifts, so that people are segregated by time or by location, so that they're not necessarily working all on top of each other at the same time. You can stagger schedules, implementing social distancing, and having the ability and encouraging employees to clean and disinfect especially their hands, on a regular basis, and good hygiene practices. And I'll mention that, yes, you should publish these policies, put them up on the walls, etc. Really getting buy-in from your supervisors to ensure that that they're really being implemented, that it's not just on paper, because that's one thing that OSHA really looks at, is not just whether you have these types of controls and policies in place, but are you really implementing them, or does everybody just kind of treat it like a joke? This is a great time to really make sure that you're engaging employees, getting buy-in, and besides, you have a duty to detect hazards that are reasonably detectable. So if everybody is just treating social distancing like, we're not going to do that, if they ignore you, well, then it could lay the groundwork for a citation, even if you do have the perfect policy possible for your workplace. Failing to really implement it and making sure that everybody's buying in, it really does to an extent fall on the employer to make sure that's happening. So the next level in the hierarchy of controls is the engineering controls. And these are when administrative controls just won't quite eliminate the hazard. So you might have to create some kind of a plexiglass or some kind of physical barrier, or negative pressure ventilation, or high efficiency air filters. So that's where you engineer a hazard away. And then finally, if all else fails, and especially in higher hazard industries, if you have to use PPE, that's what you do. And that's the respirators, and of course the gloves. And just because you have the respirator on doesn't mean you don't have exposure to the eye, so then probably a shield on top of that. So those types of, that kind of gear. Gordon, would you mind advancing for me? So how do you handle a work refusal? Under OSHA, employees may refuse to work due to a hazard. That doesn't mean you have everybody walk off your work site. Very far from it. They have to meet certain criteria, and they have to meet all four of them. The first one is that the employee has to ask the employer to eliminate the danger. They have to ask you. They can't just walk away. The second is that it has to be a good faith refusal, and they have to really believe that there's an imminent danger that must be fixed. Not potential, not, later on today, imminent. And they have to really, it has to be a true belief. And it has to be a reasonable belief, a belief that's reasonable to most of us, if we use our common sense, that death or dangerous injury really would occur if we eliminated the hazard. So again, if you have everybody's social distancing more or less, people aren't making too many mistakes on that. People look like they're washing their hands. Nobody has an elevated temperature. People look like they're healthy. Then a person probably doesn't have a reasonable basis to stop work. Then again, if people are hacking and wheezing and they're all bunched in together, and if an employee says, "I'm not going in there," they probably have a good case not to refuse to work. So, and the final criterion is that they just don't have enough time to go through normal channels, through OSHA, to get the hazard fixed. So they have to meet all four. So that does not mean that everybody can walk off your work site, and they can, if folks are saying, well, it looks like the federal government's giving everybody 2 free weeks of paid leave, and I think I'll take it now. It doesn't work that way. Gordon, would you mind advancing for me? All right. Let's talk about changes to OSHA and VOSH enforcement. Go ahead and roll, please. So the reason I was telling you about all these best practices is when there's a guidance, behind the guidance, look for a general duty violation. What do I mean by that? If you geek out on this stuff like I do, you have your regs, the 1910 CFR 1910 regulations on your desk, and those are the OSHA regs, and those encompass the general industry standards that OSHA follows. It can't contemplate every single possible contingency, so that's where general duty clause comes in. It basically says that you as an employer have a duty to provide a workplace that is free of recognized hazards. I'm not saying you necessarily recognize that someone has COVID-19 on your floor, but I think that while it hasn't been litigated yet, we don't have, it's just way too soon for us to get case law. I think OSHA will have a strong case in saying, if an employer is not following these guidances, if it's not following best practices, it's probably ignoring a recognized hazard in the context of a pandemic. So this is not your usual time. I know, the flu could theoretically happen anytime. That's not what this is. This is a pandemic that is hitting many, many workplaces, and it's everywhere. So I think they'll recognize it as such. So a best practice in light of this, what was the first thing I said about the best practices? It was putting together your plan, documenting what you're doing, engaging your employees, and culling the knowledge of all those around you. And I'm not saying you have to buy everybody a mask, an N95, respirator. I'm not saying you have to get face guards. I'm not saying you have to do all this for everybody. I'm just saying that you have to take a look at the hazards you have, and then come together with a well-documented plan and how you're attacking it. And if you do that, and it'll make my job a whole lot easier if OSHA shows up, we can then show OSHA and say, look, these are the steps we took. Every employee doesn't have to agree with everything you're doing, but it does have to fit, reasonably within the bounds of you've given it thought, and you've actually looked at the best practices, and you use the tools that make the most sense for your workplace. I think really, if you do that, you document it and articulate it, you'll be fine in terms of general duty clause enforcement. Gordon, would you mind rolling for me? So the guidance that's coming out from OSHA is important, CDC. Maybe other health departments and agencies, state level, federal, and keep an eye open for your OSHA guidance. I have a blog, and my firm, we put out news every time OSHA comes out with a new guidance or a new development, so that we keep people apprised. It'll pop up on your email if that's something that would interest you. And I will tell you, I think that industry partners, AGC is fantastic. AGC is on top of this. And so trade groups like that, they are honestly staying a step ahead of OSHA, and they're putting out some great guidance. And so keeping apprised of that and using those resources is a great place to turn as well. Would you please turn? So OSHA is a regulatory agency, but it's also an employer. And so I know from my personal experience, I've had to be a labor commissioner, which means I've got a team of folks that I have to look out for their safety. And so, and you're also dealing with the pressures of, they're dealing with the pressures of coronavirus. Right now, they're getting flooded with calls. They have way too many to deal with. So in terms of the federal OSHA, they have a team that is vetting complaints, trying to get them addressed. And I'll tell you, for a lot of these folks, abatement is key. And if they know that you're using best practices, and when you're not just ignoring situations, but when they come up, you're actually developing, you're learning from them, and you're developing an attack plan that's reasonable by your resources and reasonable by the level of hazards, then they'll be fine. And so I call it the, these aren't the droids that are looking for a move along moment, where they ask you, okay, we got this complaint, what are you doing? And you let them know what you're doing, and they just move along and they move on to the next one because they know that you're doing things the right way. So another pressure they're dealing with, and it's not just the crunch of complaints, is they want to keep their own workers safe. And they don't necessarily want to expose their workers having to go from workplace to workplace all day and potentially exposing themselves, especially if they're COVID-19 cases. So they have a strong interest in not exposing their own folks. And so I spoke with one of their managers at Federal OSHA. He told me, look, we're trying to handle this from headquarters by fax, by phone, however we can do this. If someone falls from a crane, yeah, we'll show up. But apart from fatality and catastrophe type situations, they're scaling back. Now, they haven't cut off those, co-enroll, Gordon. They haven't cut off all inspections beyond catastrophe and fatality. But there are fewer on-site inspections. Now, you do have, if a compliance safety and health officer is driving by and happens to see, like a case I was just dealing with a few minutes ago, in which they see someone engaged in unsafe work practices, yeah, they're going to stop and they'll either correct it or open an inspection right then and there. So that does happen. But there are fewer on-site inspections and definitely fewer of those surprise programmed inspections. And so they're scaling back and focusing on the hazard in front of us. And it's changing the way they do business. I think at the end, we'll probably see more no inspections. And that's when they identify, they say, look, this complaint came in. Let me know that you're handling it and we'll move along. No inspection. So I think it's reasonable to believe that we'll get more of those types of circumstances. So they're letting employers reply to their phone calls and their faxes by writing and posting a response, and employees get to see the response that they post. And so that's how things are being done for now, and we'll see how it develops going forward. Go in advance, please. Let's talk about respirators and personal protective equipment. Go in advance. So, in fact, you can just scroll through the next 2 or 3. There are engineering controls for very high and high, you can stop here, risk employers, and that's generally healthcare. You know, if you're transporting people in ambulances, if you have direct contact with people who you know, where there might be a high number of COVID-19 infected individuals. That's probably not anyone who's on this, but I leave those slides in just in case you have to have personnel engaged in much more high hazard activities. Even medium hazard, I'm not so sure that will apply. That's more like retailers or anyone who has a lot of foot traffic flowing through a school. I think you don't have that. So you may, maybe you might consider yourself more medium hazard if you have that many folks on top of each other in a densely condensed area at a plant. But otherwise, I think, go and scroll. I think most of you will fit under lower risk. So, and for lower risk, it's the administrative controls and also just monitoring, as I said, those different sources for guidance and any communications, so that you can just kind of stay apprised of what's developing with the coronavirus and learning best practices. Go ahead and scroll again, please. So respirators, you may not require respirators, and you may have an employee who says, well, I'd like to wear one, or maybe you'd like to make them available to your employees, and you certainly may. And that's becoming, the surgical masks are certainly becoming the non-medical surgical masks that just kind of, they don't really protect you from breathing anything in, but just kind of block you from spreading anything out. Then that's, even if it's just the bandanas and the homemade cloth masks that people are making, that's becoming encouraged by CDC. And even in some localities, it's becoming required. I understand that workplaces, some workplaces are requiring them in certain localities. I'm not aware of them in Virginia, but just keep an eye on that. So, but the surgical masks, you don't have requirements. There's something called Appendix D. It's in that section of the code that covers respirators, 1910.134. And so Appendix D provides information employees need to know in terms of storage and keeping it clean and reuse and things like that. And so you don't have to provide that if it's voluntary use of a surgical mask. There are no OSHA requirements for them. They can rewear them. And if it's something that you want to ask employees to do, it's advisable to train your employees in terms of recognizing symptoms and how to wear it and how to store it, if it's something rewashable, how to wash. So that's a good thing to do. The N95 filtering face pieces, those the ones that actually protect you from inhaling particles coming in. So if it's a voluntary use of that, then you do have to provide that Appendix D information. Go ahead and roll, please. So let's talk about mandatory usage if you require people to use respirators. So again, for surgical masks, there are no additional requirements from OSHA. Now, if it's an N95 filtering mask piece, filtering face piece, then you do have to have a written program. You, of course, have to do the initial fit testing, and that fit testing is the same as it's always been. And so there has been guidance that has come out that, and at first it was just applied to the healthcare industry, and now it's applied to all industries. And really the basic goal of the guidance that came out was embracing the reality that these filtering face pieces we're running out of them, and we don't have enough. And so strict adherence to the respirator requirements is not realistic. But OSHA does want, of course, like we all do, we want to provide maximum protection possible under the circumstances. So the guidance that came out is allowing the agency some leniency so that there's appropriate respiratory protection is required for healthcare personnel who are providing direct care to patients, but they're also directed to conserve supplies. So there's kind of a conundrum that people were placed in where there was shortages, but then there was a standard. So let's talk about what's some of the relaxing the standard is that has come into place. Go ahead and scroll. Thanks. So there is, so now what has relaxed is the annual fit testing and allowing people to reuse those face pieces whenever they can't they can't have a new one if there are not enough in supply, and also it's just asking folks, look, you know, you need to just try to reuse them whenever if you have to, as long as they're not damaged, you're not breaking the seal, and they can be reused. So the requirement that you can't have facial hair blocking that seal is still in place, because if you're blocking the seal, it's not effective, and so it does no good. Not nearly as much. It's just not providing that full protection it's intended to provide. So there is no exception for no religious exception for facial hair for those face masks. But if someone is required by their religion to have facial hair, then there are looser fitting alternatives that can be made available. Gordon, would you please roll? So there's discretion now in the guidance. The field offices may use their discretion. So if you're doing the best you can with what you have, if you're making a good faith effort to comply, then the agency will say, okay, we get it. That's good enough. And so also, if the N95 is an NIOSH approved face mask, OSHA has said, look, you can use other NIOSH approved masks that give the same or better protection. So in addition, it could be the N99 or N100 or the P95, the P99, P100, the R95, 99, 100. I think there's a K series out as well, international. So you can use those other face pieces that if they provide equal protection or better, and so you can you can also use the reusable respirators with the appropriate filters or cartridges. You can also use powered air purifying respirators. So and one other thing, in order to preserve the supply of these respirators, OSHA has asked, when we do the fit testing, we don't use destructive methods, but you try to preserve it so that that it can actually be used. Because with every fit test we destroy one, that's one less in use that could save a life. Gordon, would you please roll? Oh, so that's the end of my presentation, 5 minutes early. And Gordon, unless you have any other questions, I will tell you, I really wanted to get this out quickly because human life is at stake. And so I want best practices to be well known, everyone to be thinking about this, working together, working with employees. It's a big win for you from a business standpoint and for your employees. And so OSHA, I will tell you, it's good not only in terms of good life-saving work to really try to tack on these issues, it's also good to build a relationship with the agency. The agency is doing its best to, with its resources, to try to put tools in your hands and give you the flexibility you need to try to make common sense decisions that take into account both the dangers, the hazards that people are dealing with, but also your resources. And so they're doing their best, and I think engaging with the administration, engaging with OSHA and VOSH. If you don't have someone on your direct dial from the agency now, get one. They want to talk with you. And so you have folks in there, they're in it for safety, and they want to engage with you. It doesn't mean if you call them that they're going to show up at your doorstep and then try to open an inspection. They really do want to work with you. So with that, I emphasize that employee relations right now, sharing information with employees and getting information back and doing the same with the agency, it's a big win both for safety and for your business model. If I can be of any assistance to you, we have a COVID-19 task force that is answering questions by the hundreds every day. And so not just on OSHA, I'm very OSHA focused, but we're also answering questions on WARN, on payment of wage, Fair Labor Standards Act, a whole host of issues. And so if you need information, either I'll help you or I'll find someone who can. But I want to let you know that this is something we have a passion for, and we're here to help. And with that, it's an honor. Thank you so much for the opportunity to address you.
Courtney, thank you very much for your presentation today. Really, really informative. We will be sharing this with all of our members, and it'll be in our member-only section. And if you have questions, feel free to give Courtney a call or shoot him an email, and he'll be glad to answer it. Thank you all very much, and we look forward to seeing you soon. Be safe out there.
Did I look tired?
No.
I didn't?
No, you look good.
This is the third time I've done this.